When we're talking about psychedelic-assisted care or healing or therapy, we're looking at moving someone through a process of transformation, which is what we're doing already in coaching anyway, right? We're helping someone move through a transformational process that's really client-led with the support of a psychedelic.
Hello, nurses and nurse coaches. Welcome back to the Nurse Coach Collective podcast. I'm your host, Heather, and today's episode is a fascinating one. We're going to be diving into an emerging frontier in holistic healing, which is the intersection of nursing and coaching and psychedelic-assisted care. Joining me today is Angela Ward, who is a board-certified holistic nurse coach and certified psychedelic practitioner who helps people reconnect to their wholeness through intentional, supported, and psychedelic experiences. Now, I got to give Angela a little bit of a longer introduction because she has some great clout that she's bringing to us. She is the founder of Guardian at the Gateway, her private nurse coaching practice, and the Psychedelic Doula Academy. I didn't even know psychedelic doulas were a thing until I read this. It's an educational platform that trains facilitators in ethical, trauma-informed psychedelic care. Angela is also the co-founder of OpenNurses.org, the organization of psychedelic and entheogenic nurses, a professional community dedicated to advancing safe, ethical, and evidence-informed psychedelic nursing practice. The amazing thing is that through her work and her leadership in the Holistic Psychedelic Nurse Collective, Angela is helping to shape the literal future of holistic and psychedelic healing and empowering nurses to be at the forefront of this movement. So Angela, without further ado, welcome. It's an absolute honor to have you here.
It's been really fun.
You get to be the expert of this episode, like 100%, because I think, like many of our listeners, this is an area that I have heard a lot about over the years. I know a fraction probably of what there is to know when it comes to the science about it. There are a growing number of nurse coaches in our community who are leaning into some really cool things that are happening in the psychedelic world right now, but it's also still totally new and foreign to me. So I'm excited for you to get to educate me and get me up to date and totally informed on everything that's going on here.
Where to start with that? I'd say that there is this emerging interest in psychedelic care. There's so many research studies that are being done about how psychedelics can really help with end-of-life anxiety, with depression, with anxiety, and a number of other issues across the board with a variety of psychedelics as well. These are still Schedule I illegal substances, although different parts of the country have legalized or decriminalized them, such as Oregon, Colorado, New Mexico, which is really exciting. One of the things that I think nurses don't recognize, though, is that nurses have been working at the forefront of psychedelic care since it was first being worked with in a Western medical context in the 50s. We know that Aldous Huxley, who helped coin the term psychedelic, was working with a psychiatrist named Humphrey Osmond in Saskatchewan, working in a psychiatric hospital where they were administering LSD therapy for patients there. And who were the people taking care of the patients on LSD day? Nurses. We had one of our eldest nurses, Kay Parley, who was one of the nurses that worked in that unit. She just died last in May, which was a great loss, but we were able to harvest a lot of her experience of taking care of patients in that time. So this is something that we've already done. Nurses have been with people as they're moving through transformational experiences, be that birth, be that dying, be that a healing crisis, and also through psychedelic experiences. So we found, as one of the founders of Open Nurses, the ways in which nurses were not really centered in this emerging field. There's a lot of medical frameworks with doctors, etc., and a lot of therapy frameworks. But who are the people that can really be with someone while they're using a psychedelic that can not only monitor their physical health and well-being, which nurses do all the time. We monitor responses to medications, but we also have the capacity to be with people in these more transpersonal human experiences. We really have the capacity to trust and be with and walk alongside someone through expanded states. We're used to being with people in expanded states in a variety of fields in nursing. So psychedelics seemed like the most appropriate place for us to join back in. The thing that got me so excited, though, is when I first learned about nurse coaching and holistic nursing. And I was an early adopter of the Nurse Coach Collective back in cohort 8. And I was like, just the penny dropped, because I was not interested in going a therapy route. And I think there's wonderful work that can be done with the therapeutic model. But being able to work as a nurse in the coaching model, along with the holistic nursing framework, is exactly what people need oftentimes in psychedelic care. So for me, it's been wonderful. I was able to use nurse coaching to help open some ketamine clinics here in Seattle, where I live, and doing work with people at the bedside, working with legal ketamine expanded state experiences, as well as working with people in non-ordinary states with other medicines in more legal or decriminalized contexts. So worked in a couple different states. And it's just really incredible what people can find when they're well supported through their healing. As nurses, we don't really lead, right? That's some of the things we really learn, is how to meet people where they're at and help them discover the directions that they're wanting to head. What healing is within reach for them? What does wholeness look like for them? Not a prescriptive model of wholeness, but how can we use nurse coaching frameworks to help people actualize some of these visions that they have for their own well-being? So it's been a really fun journey for me to help people in this way.
That's fascinating. I'm thinking about like one of our biggest pillars of teaching when we train nurses to become nurse coaches, which is, as you said, like, we are not providing the answers. We are not the experts. We are not in the lead. So you don't go into a nurse coaching session knowing what you want your client to get out of that, and you're not pushing them towards a certain area, but you are there to walk alongside them and to hold space and to kind of facilitate that journey of growth and transformation through your questions, through your listening, through your presence. And I can see how that relates to, you're certainly not going to be controlling somebody else's psychedelic journey, right? But the importance of being there with them, to be kind of like that space holder and that facilitator, and to keep it really, really safe. That makes total sense to me.
Yeah. Nursing brings a level of psychological safety for people to enter these spaces. And that is such a huge experience when, for example, I came into this work as a labor and delivery nurse who was fascinated with the portal that we come in through. And I also worked in perinatal bereavement. So it was at both ends of the coming in and going out. One of the deepest lessons in birth was the ways in which I needed to trust women, trust birthing people to lead with their own bodies and with their own breath, and to be able to, trust their wisdom, to be there to help keep them off the rails if there was any need for something. Not often, but occasionally things would go sideways, or they'd need just a little intervention. But developing that level of trust has really helped me be with people in expanded states with psychedelics, to be able to know the territory, much like one does with birth, to know like this is kind of the arc of the journey and where someone might be, to also invite different expressions than I think some practitioners would be used to, maybe more sound or movement, things that we do maybe see more in things like birth or things in dying. People will often rally or have these interesting moments where they're seeing or speaking in ways that might be outside of our conventional ways of communicating. So I love this kind of permission that we can bring in and the level of safety that we carry as nurses.
Back up with me, Angela, and let's define our terms proper for someone who, like, this is literally the first time they're really either hearing about this or hearing about it from somebody who actually really, really knows and understands what it is that we're talking about. So when we're using this term of psychedelic-assisted healing, what does that mean? And what is a psychedelic? What can that be inclusive of?
To me, a psychedelic is something that can shift our ordinary perception. We can refine that into more like classical psychedelics. Those are tryptamine-based, usually, type of molecules that are like psilocybin, magic mushrooms, LSD. mescaline, which is a cactus base like peyote or wachuma, San Pedro. The ones, or DMT, for example, a component found in ayahuasca, those often are a particular type of psychedelic that really oftentimes will bring in visual effects. It can really change the quality of the mind or observing the mind. It can also bring in different experiences of sensation in the body. But I also include in psychedelic assisted care things like MDMA, which is a molecule that's very close to approval for the treatment of PTSD. It's what we call an empathogen. It doesn't have the visual component of a classical psychedelic. It's more relational. But anything in this category that can help people oftentimes come more into the present moment with themselves or kind of unlock their standard patterns of thought. That really seems to be the hallmark for me, is it gives people a different perspective, regardless of what phase of life they're in. I would say that it's a psychoactive shift. I'm careful with using the word that it causes an altered state of consciousness, although we hear that a lot. But to me, from a nursing perspective, when we talk about altered states of consciousness, we're usually pathologizing something like that. And to me, these non-ordinary states of consciousness are part of our birthright. This is something that humans have been working with as far back as we know. They've developed over time alongside human culture and society and used in a variety of different ways. I prefer talking about being non-ordinary states of consciousness or even extraordinary states of consciousness rather than altered. And altered, like I said, can be pathologizing, but it can also mean less than whole or complete, like castrating your dog, right? Your animal is altered. I like to really recognize that these states are actually quite sacred moments for people. There are some studies that have shown that psychedelic experience has been ranked as the top 5 experiences in someone's life, including the birth of a child or the getting married or the death of a parent. So that gives you a sense of how profound these experiences truly can be.
Even myself, and I think I very much align with how you want to describe this, and it makes total sense to me why we want to avoid certain language that causes our brains to think about things in certain ways that are maybe not so positive. My follow-up question to that is going to be like, so okay, who chooses this? Who would be the right person or population to want to seek out psychedelic assisted healing? And get this, and I'll call myself out on it, and what's wrong with them? What are their problems
Wrong with
that
them?
are bringing them to this? And so, of course, as nurse coaches, we are already trained to break out of that mold, right? We don't see our patients as coming in to the hospital because they're broken and needing to be fixed. We see it because there's some healing that we get to facilitate. We don't see our nurse coaching clients as a problem to be solved, but we see it as an opportunity for growth and transformation. So in the same way, I completely recognize, like, it's not that there's a certain necessarily a certain diagnosis that somebody needs to have to be a good candidate for psychedelic assisted healing, but at the same time, I am curious, who is the type of person who seeks this out, and what are some of the most common reasons that you see people tend to lean into this side of healing?
Yeah, this is a great question. Let me back up just a tiny bit with the definition point, because we're talking about psychedelic assisted healing. A lot of people hear psychedelic assisted therapy. And I want to make a distinction between using psychedelics versus the assisted healing coaching model. First of all, I want to say that, again, psychedelic use has a history. It was often used in times of, like, for coming of age ceremonies or rites of passage or certain things like that. So these were not something that were used, honestly, microdosing. I know that's really hip right now, but they were not used in that way. I also just briefly want to call out that all the roots of Western medicine are coming from plants. We just decided along the way which plants are the ones we could refine and make useful in the hospital pharmaceutical context versus which ones were the bad plants.
That gets me every time, Angela, especially when somebody's like, I'm not really into herbs and plant medicine. I'm like, did you know that all of the chemical pharmaceuticals that we talk about, like initially they're derived from herbs and plants? We've just gotten them so processed and refined that we've lost that. Okay, anyways, I digress. But yes, thank you for calling that out.
It's really important to remember this. Yes, all of it comes from nature at some point. So psychedelics are something that have been used at different ways in different contexts. And I want to be really careful that a lot of traditional use comes from indigenous wisdom practices that are being culturally appropriated and harvested to put into a Western medical model outside of the context of the healing cultures that stewarded these experiences for a really long time. And I'm saying that in order to say that the assisted healing part is a more modern interpretation, this Western model of doing therapy or doing something with the psychedelic to achieve particular health outcome, right? It was originally being used to look at like addiction, alcohol addiction, and things like that. And I also do want to say that I think people have the right to explore their consciousness in whichever way they choose. My role as a nurse coming from a harm reduction perspective is to help people know how to do that safely in a way that minimizes the harm, right? Risk mitigation. So there is certainly a place for recreational or recreational use of psychedelics. When we're talking about psychedelic assisted care or healing or therapy, we're looking at moving someone through a process of transformation, which is what we're doing already in coaching anyway, right? We're helping someone move through a transformational process that's really client-led. With the support of a psychedelic, oftentimes we can get a lot more traction or get a lot more insight, or also the way that psychedelics work on the brain is they do create this really cool neuroplastic window where people can get outside their rigid thinking patterns and look at things in new ways or find some relief and perspective around symptoms or suffering or existential fear at end of life, let's say. So that leads me to who might be seeking this type of care. And it's a wide spectrum, quite frankly. The first and foremost one is people at end of life. I think there's a huge interest in people working with mushrooms, particularly as they're approaching death and dying, which can give people the original Johns Hopkins study looking at this over a decade ago really was looking at the existential distress that people feel. And through those experiences, they were able to find meaning and connection within the world that we live in, like their connections to nature or their place in the universe. And that isn't true for everybody, right? I'm not saying that every single person that does a mushroom journey is going to be one with everything, but that is a theme that tended to emerge and helped people live their final days with a lot more peace and acceptance and open-heartedness. Another area we're seeing people interested in this work are people that have PTSD, post-traumatic stress disorder. The obvious folks are first responders, veterans, even healthcare providers that have been really absorbing some moral injury or secondary trauma based on the people that they're caring for. These psychedelics can really help people heal through that. MDMA is particularly useful for that healing, just the way that it works. It quiets blood flow to the amygdala. It increases blood flow to the frontal cortex. So it lets people look at material that would often be far too overwhelming. They're in this activated fight or flight nervous system response all the time, and it lets them kind of process it and put it into long-term memory storage, which is so incredible. We have a crisis in healthcare around the people that are suffering from things like PTSD. There's an understanding that there's 22 veterans a day that are ending their lives in this country, which is devastating. And it really indicates how much we don't have great tools to help these folks. Those are two populations right off the top of my head. Another population that I've worked with doing ketamine-assisted nurse coaching is with postpartum mothers. Ketamine is one of the few psychedelics that can be used while breastfeeding. And it's very short acting, but it's really powerful for mood support. I've found that parents that I've worked with that are new and maybe haven't been sleeping well for 6 months, or there can be such a shift from who one is before they birth their baby. I know you have a second one on the way, but like whoa, that is such a jump, and it can be really quite an existential question as well. Like, who am I now, and who is this person that I just brought through? Or let's say you have any type of birth trauma or any kind of grieving that comes through parenting and birthing. That is a really under cared for part of the population. I think are new moms that need a lot more support just mentally and emotionally.
Interesting. And I really appreciate the language that you used of like how psychedelics can help to unlock patterns of thinking. My nurse brain, it's cool to hear you talk about like which parts of the brain get activated and which parts get shut off, because I think when you understand the science behind those things, it's actually easier to think of these, taboo substances as medications that have these physiological impacts on different part of the brains, and then understanding why it works. So then to be able to shift things in the mind to get out of patterns of thinking that translates to patterns of behavior, patterns of being, right? How we show up in the world. And ultimately, isn't that like what people always come to us nurse coaches for support with? It's like, I need to get out of something. I'm stuck somewhere, whether it's physically, mentally, emotionally, spiritually, but like there's something that is stuck and we have to help them unlock it. And so what a cool tool to be able to literally utilize brain chemistry to support us with that unlocking process.
Absolutely. But and I kind of like to flip it the other direction too, is that some people come to psychedelic care because they think that they have just a mental health problem of depression or anxiety. Those are just big categories to use, but can be more specific than that. And one of the cool things about being a holistic nurse coach is that I don't just see my patients as having depression or anxiety. We can assess their whole self. And what is it? There's so much more to wellness than you just have a neurotransmitter deficiency. Like, how are you sleeping? How are you eating? How are you going outside? Do you have any friends? Like, just looking at some of these things that we do as nurses to help people get a better sense of feeling their best. So when I work with people, we will do a really thorough assessment of where they're at. And I have to be honest, I use my nursing diagnosis handbook. When I first got out of nursing school, I threw that book out right away. And then I'm like, wait, there's a whole bunch of really good stuff in here. I've worked collaboratively with a therapist who works with the DSM. And we were trying to map DSM diagnoses onto the nursing diagnosis handbook. And she was like, this is so much more compassionate because you're not just looking at a diagnosis, but you're looking at what are some outcomes that can be patient identified that they want to strive towards, and it's evidence-based. So being able to look at someone's whole self and have them find strategies that are evidence-based through nursing practice, or thank you to our elders that have put all this together, it really can move the needle. And because people are more neuroplastic or maybe more flexible in the days following their experience, it's often easier for them to put some of these practices into play, which is really great. And if they can just make, it's like that little bit of change can stack and make more change and make more change and make more change over time. So that's one of the things that I think is really cool about it.
Thanks for sharing that side of it, because I think when I hear about a psychedelic experience or psychedelic assisted care as a standalone, it often does equate to like, okay, what I've seen in some of the documentaries they have out there, which are fascinating, by the way. I'm sure you can recommend which ones I should actually be watching to guide my self-education on. But where they're really like, okay, there's the practitioner, there's the room, you come in, you do a little bit of talking, you set an intention, you take the pill or what have you, you have your experience, you debrief and done. That alone, I'm certain can be powerful in its own way. But what you're saying is like, it's so much more than that, because you get to bring in your nursing, you get to bring in your nurse coaching, which is not just mind, body, spirit, emotion, environment type of holistic, it's also looking at your whole life and lifestyle, which is nutrition, exercise, stress, mindfulness, relationships, like all of those components. So that's very, very cool, I think, for people to know that this is not just another quick fix where it's like, hey, come in, take this thing, have this unlocking of the brain, and then leave a different person. That may happen, but then there's also the ongoing coaching and empowering you with tools and lifestyle strategies to like facilitate overall growth and healing. Am I understanding that right?
100%. And thank you for articulating it and picking up on that. And that is something I think people will be like, well, why would I want to do psychedelic assisted care when I can just go get a bag of mushrooms for my friends and blah, blah, blah. And that is because of the preparation and integration, as well as the relational safety and trust that can come through a process that we work through together. The more I've done this work, the more actually exciting and valuable is the integration process. It's really less about the trip itself, which is a wonderful experience, but it's also, it's not the thing. It's not the thing. And, I really equate it to birth, that we have this experience, leading up to birth. People spend so much time of like preparing, getting ready to bring baby home. And what's that going to be like? And then they go through this huge, people birthing their babies climb mountains. I mean, it's like internal mountains. It's just such an incredible experience. And then they have this window of time afterwards where they're like, "Ugh, what the heck just happened?" Very much after a psychedelic experience, people are like, what the heck? This aftercare, golden 24-hour period. And then there's the process of integrating the baby back into your life and becoming this new person in the same way. That is the ongoing work of integration from the experience. And it's really juicy and quite remarkable. So the psychedelic experiences, that's what brings people for sure. I think people are like, oh, I'm curious about that. But it's really seeing the ways that they can enact change in their life in a really healthy way. And nursing, of course, holistic nursing especially, we're talking about wholeness is integrating. It's not about cure. It's about finding our own definition of wellness that's complete, and what's missing, what needs strengthening, what needs refinement in our lives. It's really fun.
What are some of the most common misconceptions that people have about psychedelic assisted healing? You talked about like language and how the words we choose to describe the whole experience can impact the way we really think about it. But what are some of the common misconceptions, or maybe even like common fears that people have around this work that leads to the lingering resistance that we see?
One of them is it's a one and done process. And what I mean by that is people may think I'm going to do one dose of mushrooms and then I will be healed miraculously forever and ever. So I think there can be a lot of expectation management around this. And when we're kind of fighting uphill in a way, because the media really tends to play up profound experiences or really tragic experiences. There's not a lot of the middle road where people are like, that was really cool. And you still have to chop wood, carry water you still have to take action to enact change. You can't just be a passive receiver of the change. It just doesn't work that way. The other thing that I hear is there's this really interesting thought in the psychedelic world around taking a heroic dose. It was popularized as an idea, and also this sense of like taking a really high dose, getting super high. And I just don't think that's the method to healing. I think anyone that's willing to truly explore their consciousness is doing something pretty brave, regardless of how much psychedelic one does. I also think that for me, healing relating to the one and done part, it's not this immediate, we don't have to push it. We don't have to push so hard. I've always felt strongly that I'd rather approach this. We'd rather ease the baby's head out than run back to the OR for a C-section. Like, can we do this slowly? Can we do it at a pace that your nervous system can work with? Can we do it at a pace that's sustainable for you? So I also think it's not evidence-based, as we are learning more and more about psilocybin particularly, is we're learning about how different strains of mushrooms have different psilocybin content. So there may be mushrooms that we say 5 grams that has 10 milligrams of psilocybin per gram of dried fruit versus another strain that may be closer to 20 milligrams of psilocybin per gram. So some strains are quite a bit stronger than other strains. So just blanket saying eat 5 grams that doesn't make any sense. So that's one thing I think nurses can really help with is we can get a little more science nerdy about this. Another risk is, I think, more from nursing practice and probably Western healthcare models is the tendency to pathologize psychedelic curiosity and use rather than opening doors of communication to help people learn how to do things safely. Instead of just identifying this as you are talking to me as a nurse or letting me know that maybe you've experimented with something and you have questions about it, it makes more sense to provide information and educational resources rather than shaming or pathologizing someone's use. And there's a fine line, right? There is a fine line where people are taking a lot of drugs that they're doing it for escapist reasons or really unhealthy ways, and we have to be nuanced around that. But it doesn't immediately mean that somebody is abusing drugs. We're actually chasing people out of the healthcare system if we as nurses get really uptight about it. It's helpful if we can learn how to listen more deeply and provide real evidence around real information, good resources, good community that can help people learn more.
And isn't that just like everything, like any health behavior or any behavior at all, right? If somebody comes to you and they say, this is something that I do or do not do, then we get to, as providers, fall into the trap of judgment and pathologizing and making somebody feel any certain way that's not particularly positive, or listening, accepting exactly where that person is at, seeking to understand more about the reasons behind certain behaviors, and then using our knowledge and using our education to help try to determine, okay, if this is the chosen behavior, how do we work with it? How do we work with it in the way that's going to best set this person up for success and for health? And that makes a lot of sense to me. Angela, I want to go back to the topic of like the heroic dose, because I think you're right. That's something that people talk about all the time. I know there's plenty of people on social media who do the heroic dose and document the whole thing, and and then that gains the traction and popularity. So I have always associated the term heroic dose of anything being the threshold to be, so I don't have any equation of 5 milligrams or XYZ, but being the threshold at which you are able to leverage the psychedelic experience to disconnect from the ego being like your sense of self and your sense of self-awareness, really. And I have heard that like in that loss of self, that's where the magic can happen, because that's where you feel, if you're not a self, then what are you? Then you get that a very interconnected sort of experience. And I'm talking from hearsay, so I guess what I'm asking is there logic to that? As a practitioner of this, does that like loss of ego and that threshold exist as part of the necessary process, or is that kind of a language that celebrities use?
I love this question, and we're going to get maybe a little nerdy here for a second. So
do it.
First of all, I want to just clarify that ego is not the enemy. We need ego to function. So and I know who we are. I can drive a car. I can like be in the world, and like ego gives us a sense of self and other. And that is a hallmark of ordinary state reality, right? But it's when ego gets really rigid and stuck in patterns that we feel are unhealthy or not serving us that can get really hard to get out of. It's like a record stuck in a groove, or something's just like stuck in that pattern. There is something to dissolving the ego, and that sounds tricky in language when we talk, like it sounds a little esoteric or maybe woo. What we're talking about is what psychedelics do is they quiet something called the default mode network, which is a structure in the brain that allows us to do this differentiation from self and other, to understand time and reference and language, etc. When classical psychedelics typically, so something like magic mushrooms or LSD, at certain doses, what that does is it allows the default mode network to stop functioning quite the same way. So the default mode network, you can imagine like a ring structure, and one point kind of just talks to the points around it. When default mode network is quieted, those parts they cross, the whole brain starts talking to itself. That's why oftentimes you'll hear someone comes out of a psychedelic experience and they get this like, oh, it's all about love, or I never thought of it that way. And it's literally because they never thought of it that way. Their brain hasn't made that hasn't wired together before. So I want to talk carefully about that though, because not everybody who is seeking a psychedelic experience needs to dissolve their ego. Their ego might be pretty fragile, or it might be really stabilizing them. So it requires a really good practitioner to be able to understand the nuance. Psychedelics are destabilizing agents inherently. And we do sometimes need to be destabilized in order to reform in a really good way. Yet there are people, I work with a lot of people with complex trauma or have different situations where their ego structure, they have to hold on to it for safety. So rather than blasting through their protectors, blasting everything to just shoot their ego off completely, what that's going to do is cause a rebound effect. And oftentimes people will fall back much more quickly to their, I want to say, self-soothing behaviors, because I don't want to pathologize the behaviors that people do to kind of cope. But those are ones that usually make people feel pretty bad about themselves. Maybe they're drinking, maybe they're doing a variety of different things. So this is again to that like softening the ego. I'd rather people give full consent around being willing to let that surrender happen, and also to know that you're going to only dissolve as far as you're capable of. What helps with that is people who learn good safety and practices in the preparation work. And this is another place where nurses can help so much, as we can teach, alternate nostril breathing or meditation techniques or practices to help people learn how to regulate their nervous systems when they're confronting some confusion that can come with the psychedelic experience. But then also nurses really, a lot of people, but nurses especially, we are responsible for the healing environment, not only physically, but also energetically. Our presence, our groundedness, our own ability to be a regulated nervous system with someone else helps people feel a lot more trust and safety to surrender into that ego dissolution and let that happen. I wouldn't say that ego dissolution is the goal necessarily. There is certainly a benefit in some ways in that it lets people, after that has dissolved, they can pick things up that make more sense to them. It's like if we can let all of Heather go, when Heather comes back, you're like, I really like these parts that I want to pull back in, but these are some of the parts that I don't necessarily want to reintegrate as strongly.
Yeah.
So it's nuanced.
Yeah, but that does make a lot of sense. And also it's like, of course, it's not a one size fits model, just like nothing that we do is a one size fits all model. So that it makes total sense to me. Let me know if this is a bad idea. What I am curious about now are like some of those fears that either providers may bring or people themselves who are like considering partaking in psychedelic assisted healing may have. And the things that come to my mind are the fear of the bad trip, right? And then maybe the fear of a change or a shift happening and you becoming a different person that maybe you don't want to become. For example, let me give you an example of this. Is a colleague of mine did a very powerful trip with ayahuasca. I cannot speak to the circumstances or training of the facilitators, but he did his best to put himself in a good setting and be guided by indigenous practices. He had an amazing experience. And on the other side of it, he really found a connection to spirituality that he called God on the other side of it, that then became a pillar of his life moving forward. Beautiful. He had this amazing experience and he feels a better person because of it. Well, his best friend then, who was thinking about having a similar experience, was very clearly able to say, well, I don't want to become that person. Even though I see him as being happier, he's also, different and changed. And I don't my fear is becoming changed in a way that I don't want to become changed. So the bad trip and then the fear of change that I don't know, we can't predict. Now, I'm going to pause there because I said, is this a bad idea? Because I don't want to be speaking about fears and like putting fears into
It's
people's minds that
important to
don't
talk
already
about.
exist.
No, it's
Okay.
important to talk about it. The bad trip question comes up all the time, and we'll talk about it really quick. So, to me, a bad trip is in a place where someone has no support, attunement, or care, or a trip where there is ethical harm or boundary violations, lack of consent, etc. And that can happen. So, like the external influences on a bad trip are when you're working with someone that doesn't have a really well-rooted ethical practice, is working in a more of a silo, is not coming from someone that has much experience, for example, or, there's bad actors across the board, including in indigenous practices. So I want to be clear, like there are some people in ayahuasca circles that are touching people inappropriately. Consent and on touch are not things that we talk about enough. And it's even in nursing practice, we fail at this. We often will touch patients without asking first, and we need to seek consent all the time. This is something we all need to work on so much more. But there's also this concern around the psychological, like the internal experience of the bad trip. And those things can happen. I'm using bad trip lightly because what can happen is maybe people loop around content that's frightening or materials emerging that they don't want to look at. They may feel stuck. They may feel trapped, or people are afraid scary material is going to come up. Psychedelics are non-specific amplifiers of current mental states. They kind of bring up whatever's kind of there. The ways that I have found my clients rarely have bad trips. They may have challenging trips where they're encountering content that is, or even physical symptoms that are challenging to move through. But what can help is having a safe person that feels really grounded and kind of knows the territory. And this is where I think, like, I love working in that kind of labor and delivery nurse model, is that sometimes you don't need to just lie there with your eye mask on and be still listening to music for 6 hours. Sometimes you're feeling nausea and we need to get up on our hands and knees and practice moving that energy through the body. Maybe there's sound that needs to come. Maybe there might be things to help move these through. Oftentimes, when I said I worked with people with a lot of trauma, sometimes they'll flash back to the experiences of when they were traumatized. And we may need to do some work to help them either escape that experience or get rescued from that experience in a certain way. So to me, this can really be mitigated by lots of preparation work, a lot of relational attunement, and a lot of safety before we go in there, and then feeling safe to move through it, along with a lot of integration to help people make sense and also notice how their body might feel different by moving through it. So I hope that kind of answers it. I'm happy to talk more about bad trips. But the second thing you talked about is very, very important. Sometimes people go through these experiences and they do hit really profound changes and insights and get a completely different sense of self, which can be so beautiful and also can be really disturbing for the people around you, for sure. The other component is sometimes people might move into what I call spiritual bypassing after a ceremony like that, because they've had such a profound insight or connection to spirit or meaning or whatever, that they kind of proselytize a bit about it. They become very outward in how their experience was, and they may lose some of their ability to still be in relationship with other people. To me, the signs of a really healthy experience in the psychedelic space is someone who is made better for it, and some of the hallmarks includes being able to sustain healthy relationships. If someone is starting to peel away from all of their relationships, that can be a bit concerning. And as a nurse coach, I'm wanting to really, that's why I do integration with people, is to kind of keep track of where things are going. Someone might get enough insight in a ceremony to finally leave the toxic relationship or leave that shitty job, right? And that's could be quite healthy. But when we're talking about wholeness, we're not talking about putting someone in a situation where they're isolating from their community or they're completely radically changing things. Usually we'll encourage people to slow down in the integration process and also to be really precious about the experience, because not everyone's going to understand the profundity of what happened. And that can be really isolating, but it can also like be confusing for someone that goes through that experience to be like, well, I just had this beautiful, profound thing and it doesn't fit anywhere in my life. And so now I have to change everything in my life. So I work really hard to slow people down, to not make major life decisions in the period right after. We go slow and we work on what can you embody now. But I think that's why people are so impressed with psychedelic work, is because what they notice, they might not know that someone did psychedelic care, but they notice how they are maybe more patient in their relationships, more open, more connected, more peaceful frequently. Yeah, that's the direction I'm aiming with people, bring more wholeness in.
Words of wisdom that Peter and I leave people at the end of a conference when we have like a 3-day really transformative experience for people, and we say, go slow, go gentle when you are going back in with your family, when you are reintegrating all of your learning with the rest of your life. And please refrain from making any large major life decisions for these first couple of days because it's a shift. And so I totally get that about like really deep work and needing to take your time with that. And I can also completely appreciate how not doing it by yourself, right? The reintegration process that you're talking about of like having the right person with the right training and the right qualifications and the nursing background and the coaching background to really be able to support you with that becomes such a pivotal part of the process.
Can I ask about your friend's friend too? Do you know if this person went to an ayahuasca retreat that had any integration afterwards?
I don't know, but I think it might have been like one magical night in the Chilean desert. So I'm guessing not. I'm guessing not.
So I'd like to speak to that as a nurse coach, where I think this is an emerging field for those of us that are interested in working peripherally around psychedelics that might not be in a position to work with psychedelics directly, but this is a great place to offer preparation and integration nurse coaching, to be someone that can support someone that is traveling out of country to do medicine work, and then they're coming back and they don't have community or support or a touch point that even can create that sacred container to explore some of the material that's come up and to get help making some of those changes. So I think that's an undertapped field that we can really include as nurse coaches.
Yeah. And to reiterate from that one random story that I'm pulling out of my back pocket, again, the person who had this experience themselves, like they went through an incredible transformation. I know who he was before, and he was a very unhappy, challenged in so many ways human beings. And on the other side, he was full of life and ready to take on the world. And the shift was profound to see objectively. The purpose behind that question was not to share a negative experience, but that it brought to light for me fears that other people could have, thinking about going through this experience. So I'm going to pivot here, but what I know is that a lot of nurse coaches are going to be interested in this, but also wondering, like, can you really get paid for this kind of work? And when nurse coaches think about doing something a little bit outside of the box or maybe starting their own practice, it's always a big question and a big doubt. It's like, but I'm the breadwinner, but my financial well-being is important. How do I make this sustainable? Tell me a little bit about like your rates, your packages, and how you have navigated the financial side of building up your business.
Well, I have multiple income streams, so I have different types of work that I do. I started my business on the winter solstice in 2019, and within a couple months was the pandemic and everything shut down. And I'd say the first couple years when I started the Nurse Coach Collective, I think right in the spring around then, I can't remember exactly when we started. In that first couple years, I was surprised at how many people actually were hungry for nurse coaching. So I was doing a lot of one-on-one regular health and wellness coaching, I think till I got a sense of the people that I worked best with. It's okay to not have your niche dialed in yet. You might need to like get your feet wet and kind of play in the trenches for a bit and get a sense of who's your people. Now I do primarily preparation and integration coaching. I also do ketamine-assisted nurse coaching. So in the Guardian at the Gateway, I do one-off coaching, but then also coaching packages. Everything I do is based on a sliding scale that's rooted in the green bottle model of payment. So I have a supported rate, a standard rate, and a pay it forward rate. Don't require anybody to prove to me how broke or rich they are. That's none of my business. And I just trust people to self-select what fits for them. But I made sure that those prices feel like they're covering what my basic needs are. If everybody came in at the supported rate, I'd be okay. My hourly coaching rate ranges between $100 and $250. Let people pick that. I do offer a slight package discount if we do a larger package of maybe 5 sessions. And usually when I work with people that way, they might choose to then move into kind of a longer package together. We might do 3 months or 6 months. And again, that's kind of sliding scale based on what we're choosing. I have had, and I'm kind of considering doing this again for next year, where I've had a couple of years where I've done deep work clients where I've worked with them for a full year, and that ranged between $18K and $25K per client. I can only do a couple of those just because they're high touch. We're really going deep about doing a lot of high contact and deep work through the year. But that's super rewarding to me. I love it, not just because of the financial aspect, but because it's really cool to see what people can accomplish when you're walking with them through that period of time. The ketamine process, my approach is pretty unique. I kind of created this model, having done a lot of one-off ketamine work, but I have a program where I move people through about a 10-week process, doing ketamine-assisted nurse coaching with 3 ketamine sessions equally spaced throughout this 10-week process and lots of coaching processes in between. That ranges from about $3,000 to $36,000. It depends where I'm at in the season of my other work, that I'm taking on more clients in that way or not. But that's also really fun work to do with people. And then I have the Psychedelic Doula Academy, where I'm training practitioners, and that is a whole other revenue stream, and that's also sliding scale. And then I have my Return to Roots, it's my nursing-specific psychedelic education, and that also is on a sliding scale. Working as my own nurse entrepreneur person, I've had to be really flexible and responsive to what's changing with the people that want support from me. I've also done a lot of collaboration with other practitioners, done some psychedelic education, assisted writing modules in different ways. So I think there's different ways to put things together. I could also be working in more of a clinical practice, perhaps, if that was where my heart was called, but my heart is not called there. I like working for myself.
You're talking about numbers, some of which are really big and definitely something to aspire to, and some of which are on the smaller side. And you get to do that because you're making this choice to take that sliding scale approach, which I think for some nurse coaches is like, no way, I'm not offering a sliding scale. I need to know exactly how many clients and exactly what pay I'm getting. Beautiful. And then for some nurse coaches, that's really, really important. That is the pillar of the work that they do, is to be able to make sure that it's accessible for people. So knowing that these sliding scale models are out there, that there is even guidance, right? You said through the green bottle model to follow in terms of how to set that up. It brings a really heart-centered approach to, even talking about the financial side of things. But then knowing that, hey, it's also possible to work with one client and have that be a $25,000+ earning for you for a year commitment. And not only is that awesome, but you're like, that's some of my favorite work. Like, that's some of the most beautiful work, where you get to really go deep while knowing your boundaries and knowing your bandwidth to not take on too many of those things just for financial gain, because then you yourself become depleted. So it's an absolute balance.
Let me speak to that too, is I think when nurses hear that, they might be like, oh my gosh, I could do this expensive high ticket process. But I want to be really clear that you don't want to get in a relationship with someone for that long if you don't know them and have a really good sense ahead of time. So there are certainly people that have wanted to work with me longer term that I know that they're not coming into a healthy way to work. And that's one of the things I love about having some different access points, is I ultimately get to choose who is the right energy spend for me too. When we're working in the hospital, you take what patient you get. And a lot of times that's really great, but sometimes it's really, really hard. And working for myself, I only have so much energy, and I get to pick who I spend that time with. And I want my clients, they're ones that are like, hell yes, I'm ready. Let's do this. I'm going to really put effort in. You're not going to have to drag me through this. That's so fun.
I say the hell yes or the hell no to the person that you're working with, and knowing that, like, I get to be excited about the people that I choose to take on as my clients. And then I also get to be really empowered in my no's for the one that don't feel like a great fit. I mean, that's one of the greatest joys of being an entrepreneur and not having to take whatever patient load was, handed to you that day when you clocked into shift, but really having that choice. So super important.
Yeah, I think that's a huge growth edge for nurses. And I think I learned it from Rich Litvin was that yes lives in the land of no. And we have these hearts for service and for wanting to include everybody. But for me, adding the sliding scale that at the lowest rate still sustains me, lets me feel like I'm creating access points for different people so people can get care. I also have a wide community of people that I can refer to if I'm not the right fit for them or it doesn't work. But then it means when I find someone that's a real yes for me and for them, it's like it's next level. I'd always rather find that.
Always, because that not only you feel good, you feel the most fulfilled, you have the most enjoyable experience, but that's also where I find like the most effective work happens, right? And the biggest transformations can really take place. Angela, final question. I'm so appreciative of all of the time and energy that you are gifting to me and to our listeners today. What advice would you give to nurses who feel called to this kind of innovative, different, heart-centered work?
One thing I would say is don't forget your nursing roots. I think that we have such a rich tradition in nursing that can serve in a heart-centered way that we sometimes lose connection to when we're really getting burnt out at bedside patient nursing. We have some incredible nurse theorists. We have incredible, just a list. Whenever I read my holistic nursing book, I'm just like, I get so excited by it, really. So don't forget the nursing roots. And I think follow the nursing thread into this care model for sure, because you already know so much as a nurse. There's some other things you need to add on, but you don't need to go back to school and become a therapist. You don't need to go back and even get your DNP or get your, advanced nursing skills unless you want to. But nurse coaching really can allow you to work with people work with them right now. Nurse coaching lets you work with people today. You don't have to go back to school for 3 years. You can still really have deep impact in this way. If people are interested in learning more about psychedelic care and how they might work with it, there's a couple paths. You might consider doing a ketamine-assisted therapy training. There's a couple really good ones out there, and I'm happy to share my information if people just want to chat. I'm always down to talk with people about their path and really encourage nurses to join Open Nurses. It's free. It's really cool. We did monthly interviews of nurse luminaries that have worked in the psychedelic field, some of whom are just RNs and have done very incredible work in the field. So that's great to look on the YouTube channel and watch some of those interviews. And yeah, happy to talk with anybody that wants to know some ways they could go deeper.
Well, that is such a generous offer because you are indeed a wealth of knowledge and information. And I will for sure include all of your information, links to your website, links to the programs that you run inside of our show notes. So on behalf of all of our listeners, Angela, thank you so much. This has been a fascinating conversation, tons of learning for me about the world of how nursing and coaching and nurse coaching can intersect with the world of psychedelic-assisted care in what I'm now understanding is like a really, really crucial way. Like they are pieces of the puzzle that really fit together in a very necessary way. So thank you. Thanks for being here.
Pleasure, truly. Thank you.